One of the most common questions I get from the physicians that we help within the incubator program is why a year-long membership? What happens if somebody wants to stop early, or what happens if somebody wants to keep going after the year, as well as how do you even treat somebody within the context of a year? Like, what does that look like? As somebody that did shorter programs before moving on to the year-long membership, I can say wholeheartedly that extending the membership to a year has been very beneficial for not only the patients, but it also creates a really nice cadence for you as the provider. And let me kind of explain how. So, the way we start out is we do an initial foundational assessment where we review their blood work. So they fill out their questionnaire forms prior to coming into that initial visit, and we review an extensive blood work panel. At that time, at the foundational assessment, they have not committed to the full year. So at that time, you are reviewing the imbalances in their internal and external environments, and you're starting to kind of create this roadmap in your mind as what kind of healing does this person need. Now, this is personalized medicine. This is you're not putting everybody through the same order, the same tests initially, nothing like that. So it might be best for them to do, some gut work first. For somebody else, it might be best to do adrenal and nervous system. For somebody else, it might be best to really work on their sex hormones initially, or detoxification. I mean, the options depend on the needs of that patient at the time. So we do the foundational assessment. We're reviewing the blood work. So now we have subjective and objective data to make our personalized recommendations. So I might say to a patient, so say somebody comes in and they're, 48 years old, and they have bloating, some constipation, some IBS, some constipation, fatigue, brain fog, things like that. And I'm looking at their labs, and their thyroid panel is suboptimal. They're deficient in vitamin D, B12, iron, um, and but everything else like looks pretty good. CBC, CMP, lipid, everything else looks okay. Their insulin might be a little bit high. So what I might say to that person is, okay, at this base foundational level, let's go ahead and get you started on some foundational supplementation to restore those nutrients. And we'll talk about foundational things, like I'll get them on a low inflammatory diet. We'll talk about sleep, stress, exercise. So that's very specific and personalized to them as to what's going on. Then I'm going to take the second part of that foundational assessment and really start to educate them, because this person has adrenal, gut permeability kind of issues just at that foundation. So I might say to them, all right, now listen, in the course of the membership, this is how I would recommend proceeding. I first want to do a stool analysis, and I might also do an adrenal saliva curve at that time to just kind of see what their cortisol's doing, as well as, looking at their gut. So, and then, so let me kind of walk you through that. So they get their recommendations at the foundational assessment. I discuss what advanced testing that I'd like to start with. Now, mind you, if somebody else comes in with more signs of mitochondrial dysfunction and more signs of like toxicities from environmental toxin overload, things like that, I might start with more of a organic acid test, or a mycotoxin test, or even a NutrEval. Like it just kind of all depends on your hypothesis, depending on your analysis on your first evaluation of the patient. So let's kind of walk through like the 12 months. So visit one, so they're like, yes, I'd love to move forward. And I'm like, okay, I'm going to order that stool analysis and the adrenal testing, get started on this foundational plan, first. So they get their supplements, they get their advanced labs, and they come in for visit one. And at visit one, I'm reviewing their stool analysis and their adrenal saliva curve. So that's what I'm doing on visit one, and I'm giving them their plan. Now, that's month one. It's going to take them a few weeks to get their supplements or prescription, whatever I'm doing, based on the plan for those advanced test results. And it's going to take about, at least 4 to 6 weeks for them to kind of get rolling on the plan itself. So I'm going to see them in about 2 months after that. So now we're at month three. And what I normally do is I normally alternate between advanced testing and blood work. So month one, I'm reviewing the advanced testing, and then I might order repeat blood work for my foundational panel based on what was abnormal. So now we're on month three, because I see them about every 8 to 10 weeks, I would say, in the membership. And so now we're on month three, and I'm reviewing the abnormal blood work, and I'm seeing how they're doing from the gut as well as the adrenal plan that I just did. So at this point, it can I'm responding to the blood work. So now I might be pulling back on some of that initial foundational supplementation. I might be moving from a remove protocol to repair now for gut. I might be tweaking some of their adrenal supplements, but I'm kind of seeing how they're doing at that point. Now, at this point, I might, if they're still having some bloating, I might so now I'm thinking advanced tests, like what additional advanced tests might I do? This is where, like I said, like this personalized treatment come in, because everybody's different. So now if they're still having some bloating, I might do like a SIBO test. I might do an OAT test. I might kind of look a little bit deeper into that gut at that point. If their adrenals, and nervous system seem to be okay, I might repeat that saliva adrenal curve to see if we've kind of moved that needle a bit, or I might add on some sex hormones at this point. Sometimes I don't do the sex hormones initially because I'm trying to kind of do some of that foundational work first. So now we're at month three, I'm treating the blood work, I'm treating what came in there, and then I'm ordering advanced. So let's just pretend that this person had some bloating and now I'm doing SIBO, and I'm going to go ahead and repeat that saliva curve, but I'm going to add on sex hormones at this point because now I want to see what that progesterone and estrogen are doing and things like that. So now we're about month six-ish, 5 or 6. And I'm at that appointment, I'm going to review the saliva testing. And then I'm also thinking about what additional blood work to order at that point. So as you can see, I've done about 3 appointments. I'm on my 3rd appointment and I'm at month 6 now. And in my membership, I had 5 appointments with me. So what I frequently find is about month 6, people really start to kind of, first of all, get the hang of how their lifestyle and their daily choices impact their health and healing. And they also tend to we start moving into a bit more of a mental health space, because as the body starts to heal and the body starts to feel better, then I find that a lot of times they almost start to, like, I call it kind of cleaning out their closet from like a psych perspective. It's just past traumas or toxic relationships with others and with themselves start to oftentimes come up. And so this oftentimes the second half of the membership is normally where I pull in the therapist that I have as an independent contractor. They'll have their appointment with them at this point. But in terms of like testing and treatment, we're continuing to kind of chug along here. So we're at month 6 and now we're reviewing the advanced testing. And now I'm deciding what needs to be ordered at this point. I might need to do blood work again. I might need to recheck their insulin or their thyroid if I'm kind of keeping tabs on that. A lot of times I'll do blood work, sex hormones to kind of track that along with the saliva. If there's an issue with like toxins in the environment, a lot of times at this point, I'm starting to evaluate that. We're starting to educate in their environment, and I might order like the NutrEval or the mycotoxin test at this point. So you're personalizing depending on where they are. I have had plenty of patients where we might still be working on the gut at this point. Like there still might be other things going on at that level. So um you're constantly like revisiting the foundational recommendations, and you're revisiting those foundational principles to make sure that that's kind of solid for the person. So um So we'll go ahead and we'll order that advanced testing. Now, when they come back in that next time, which is about month 9-ish, now is when I start to talk about, more longer term goals. Like what is our goal at that point? Because I have one visit left with them, and I need to know if that visit, if we're continuing to kind of pull back the layers of the onion or of testing and things like that, or are we um are we going to review blood work one last time and then kind of get them on a maintenance plan? So second to last visit, I typically have that discussion with them. Like I'll review what we have done in the past 9 or 10 months. And I'll say, these were your goals coming in. This is what we have treated. This is where we are now. We have some options. You can either we can continue to test and treat and heal and continue on. And at that point, like now I would recommend blank, like whatever test would be recommended at that point based on that patient's clinical progress. Or if they have felt that they have healed to the point where they are happy with their progress, and they've learned enough about themselves that they know what they need to do to kind of keep themselves on this path, then a lot of times I'll repeat that initial foundational panel. So I'll have that final blood work done at that last visit, and I'll get them on a maintenance plan, and I'll write up a really nice plan that's a nice handoff back to their primary care, saying like, these are the labs that should be trended every 3 to 6 months. This is a maintenance supplement plan, and so on and so forth. So if they choose to continue on, then we have a maintenance membership. But every patient comes in at this first level membership, which is 5 visits with me, 3 to 5 visits with the health coach. I did 3, but now I recommend doing 5 visits with the health coach that are kind of in between your visits. And then I also had a visit with the therapist. Now, the reason for that is because we all have had this experience where people's MSQs don't reflect their severity. It changes. Some people are underreporters, some people are overreporters. Some people just need more frequent visits and has nothing to do with their symptoms. They just need that kind of support. So you just don't know until you start working with somebody. So everybody enters in that first level membership, and that reduces confusion, decision making for the patients. But then after that first year, you're inviting them and you're having that discussion as to where to go from here. Are we going to do a maintenance where I see you 4 visits a year for year 2, or maybe 2 visits, or maybe we kind of keep going with this same level because there's still a lot of work that we need to do. But I have found that this cadence this year, if you kind of draw it out for the patient like that and really think through um, how you move a patient through just body, mind, spirit healing, which is what we do in functional integrative medicine, you'll see that it just takes time for them to um, just get the plans in place and to just kind of be able to adequately see if your plan is moving the needle for them or if things need to be shifted. And so if the timeline is condensed, shorter, then I've found that it's kind of hard to really see how that goes for the patient. And like I said, that second half of the year, the 6 to 12 months, I think it's a real opportunity to really stand alongside that person and help them really solidify, these principles of healing and health, and um, be able to kind of work with them through these behavioral changes and any kind of mental health things that might be coming up for them. And that's where I think a lot of the growth and the healing occur. So that's kind of a broad overview of how I walk through that first year with a patient. Again, the way we the way we help physicians kind of create this membership is you kind of start with a bit of a template. You start with a bit of a blueprint, just in terms of how many visits, what independent contractors you might want involved, what educational series you might want to have for the patient. But the actual visits, the order in which you treat, how quickly you move through healing with a patient is all unique and personalized to that patient and their situation. But I think it's important to have a bit of a blueprint to work from, a foundation to work from. So I hope that's helpful and talk to you guys soon. Thanks.